is time for Medical Monday. Dr. Eric Johnson's here with Aurora Bay Care. March is National Colon Cancer Awareness Month. Let's start off first of all and explain what colon cancer is.
Sure, so the colon and rectum are about the last 5 feet of the large intestine, so they're kind of synonymous, and colon cancer can affect many people of all ages. There's a number of symptoms we look for with colon cancer and also a number of tests we want to talk about in terms of looking for it.
Okay, so let's start with, who is most at risk for colon cancer?
Sure, so the number one risk factor is age. So we find that people over 50 are the people that are highest risk for colon cancer, but also having a family history puts you at a significant risk as well. And we're finding actually younger people are being diagnosed more and more often now with colon cancer, unfortunately.
We talked about this story last week in Wisconsin Tonight about millennials having such a high risk of colon cancer, and you said, just the foods we're eating, the obesity rate that's high, those are things that are risk factors.
Yep, absolutely. So we know that smoking, we know that age, obesity, having some genetic component, those are all high risk for colon cancer risk.
Exactly. So when we're talking about symptoms, what should people be on the lookout for?
Sure. So big things would be abdominal pain, bleeding that you notice, change in bowel habits. That bleeding can either be bright red blood or it can be a darker stool sometimes. Change in your appetite. Anything that just seems funny to you, weight loss obviously are important. But it's also important to note that once people have those symptoms, sometimes the cancer is already there. It's really important with these screening tests to know that we can actually look for cancer before it's there and remove those polyps before it becomes a cancer.
And I think that's something we need to talk about. With colon cancer, sometimes it's in that later stage when it is diagnosed because you're noticing those symptoms. And I think that's why, it's so important to get those testing done. What types of things can you do to catch this kind of cancer early? Sure.
So colon cancer is a common diagnosis. It's the number 4 most common type of cancer in the U.S., but the number 2 most fatal type of cancer. So we really like to find it in the early stage or even in the pre-cancer stage. Our most common test is a colonoscopy, and that's a camera procedure that we look inside the intestine. And the important thing is colon cancer starts as pre-cancer growths called polyps. We can remove those polyps during the colonoscopy, and that prevents cancer altogether. Now, there's some other tests if people don't want the camera procedure, like testing your stool for blood, testing your stool for DNA for cancer. There's also a CT scan option. But we find that the gold standard is colonoscopy, and the benefit is we can find those pre-cancer lesions before they actually cause symptoms and cause cancer.
And don't be afraid.
Absolutely. So, it's a test that I think people are afraid of the preparation for it, afraid of the test itself. We keep people very sleepy. They're very comfortable during the procedure. As you have experienced yourself,
I've done it. I've had 2 colonoscopies. So important. It is not scary. And like I always say on the show, if we can get one person to get their colonoscopy who needs one, that's so important.
Absolutely. So we start at age 50 for most people who have, no risk factors. We start younger in people that have a family history. And if you have symptoms, of course, speak to your doctor. They may recommend a colonoscopy or other test sooner than age 50.
Super important to talk to your doctor. All right, thanks so much for being with us. For more information about colon cancer awareness,